Welcome to the Health, Balance, and Wellness channel. Your oasis of peace. Is diabetes really a life sentence? Many people wonder if, once diagnosed with diabetes, they're forced to live with it forever, with injections, medications, and constant checkups. In reality, several studies and scientific evidence demonstrate that this isn't exactly the case. There are dietary strategies that can radically alter the course of the disease and, in some cases, lead to a surprising improvement in quality of life. One of the most interesting discoveries concerns the importance of breakfast and, specifically, the use of a simple and natural food that has proven effective in improving blood sugar levels: oats. A long history behind it. Diabetes is certainly not a recent disease. It was already known in past centuries, albeit under different names and with remedies that seem almost absurd today. In ancient times, it was described as a condition characterized by excessive and continuous urination. Treatments proposed included foods such as wheat, grapes, honey, and berries. It's curious to think that honey was even recommended for people with blood sugar problems, but that was based on available knowledge at the time. Only many centuries later, around the time of the birth of Christ, was the disorder better defined and called diabetes. In the early 20th century, however, some German medical manuals even recommended a high-carbohydrate diet as the ideal treatment. These recommendations would seem nonsensical today, especially given the widespread use of the ketogenic diet, often promoted as a valid strategy for lowering blood sugar levels. Harold Himsworth's turning point. A major breakthrough came with the research of Sir Harold Himsworth, a physician who was the first to clearly distinguish between two types of diabetes. His studies revealed surprising results. Some diabetic patients showed improvement when they followed a high-carbohydrate, low-fat diet. This finding was in stark contrast to modern recommendations based on high-fat, very low-carbohydrate diets. This apparent contradiction has sparked a debate that continues to this day. Is it better to almost completely eliminate carbohydrates or to favor foods that contain them, as long as they are high quality and combined with a balanced diet? The latest research. An experiment conducted in Germany in 2013 provided extremely interesting data. A group of researchers fed patients about 2.5 cups of oatmeal 3 times a day, accompanied by herbs and vegetables. The diet was very low in calories, around 1,000 calories a day, and lasted only 2 days. The results were surprising. The simple dietary intervention led to a significant improvement in blood sugar levels. This demonstrated that oats could play a significant therapeutic role in the management of type 2 diabetes. An emblematic clinical case. A concrete example was documented a few years later with the case of a 67-year-old woman hospitalized for lung problems. Initially fed via tube, she was offered a diet of oats and vegetables. Within just 5 days, her blood sugar levels dropped dramatically, surprising even her doctors. It was a clear demonstration. A targeted dietary change can lead to rapid and tangible results even in people who have suffered from diabetes for a long time. Why do oats work? Oats appear to have a direct effect on insulin sensitivity and the control of blood sugar spikes. Not only does it reduce the need for insulin, but it also lowers blood sugar levels very rapidly. Subsequent studies have confirmed this effect, showing that the benefits can last even weeks after stopping the oat diet. This finding is particularly significant considering that excess insulin in the blood, a common condition in people with type 2 diabetes, promotes fat storage and contributes to weight gain. A daily approach. Those who have experienced the benefits of oats firsthand tend to incorporate them into their diets on a regular basis. A breakfast based on whole oats, enriched with red fruit, goji berries, or legumes, is an excellent starting point for stabilizing blood sugar levels. In 2019, a systematic review of the literature confirmed the benefits of oats, highlighting how their regular consumption improves disease management and reduces the need for medications. So why is there still talk of the ketogenic diet? The question arises, if oats and complex carbohydrates work so well, why do many experts continue to recommend high-fat, low-carb diets? The answer lies in the underlying causes of type 2 diabetes. Today, we know that one of the main causes of insulin resistance is the accumulation of saturated fats, especially animal fats. When these fats are deposited in the liver, pancreas, and muscles, they interfere with the proper functioning of these organs and reduce insulin sensitivity. Therefore, although it may seem intuitive to eliminate carbohydrates, the real problem is often represented by excess saturated fats, which compromise sugar metabolism. An important warning. It's crucial to clarify that this type of dietary approach cannot be undertaken independently without the support of a doctor or specialist. A diet capable of rapidly lowering blood sugar levels can pose risks if not properly monitored. Drastic reductions in blood sugar levels can cause tremors, fainting, or even serious complications. For this reason, it is essential that any significant changes in dietary habits are supervised by qualified health professionals. Conclusions. Type 2 diabetes, far from being a death sentence, can be managed and improved through targeted dietary choices. Oats, a simple and natural food, have repeatedly proven to be a valuable ally in controlling blood sugar levels and reducing the need for medication. Scientific studies show that it not only lowers blood sugar levels immediately, but can also provide long-lasting benefits. However, caution is needed and these treatments should always be undertaken under medical supervision. Ultimately, science shows us that not everything is written and immutable. Even a widespread and feared disease like diabetes can be tackled with new, effective strategies that are accessible to everyone. Please note that this video is for informational purposes only and should not replace medical advice. If you have any questions, please contact your doctor. If you like our videos, please leave a like and subscribe to our channel so you don't miss any upcoming content. See you in the next video.